Hi, guys.
Hi, David. How are you?
Good. How are you?
Good. Thanks for joining us. We
Yeah,
appreciate you being here.
I'm happy to.
Um, so, do you go by Dr. Younger? Is that
No,
how you just David?
No. Yeah,
Okay.
please.
So we're going to kind of get started, and people can kind of just jump in as they arrive. We already have a few parents on, but again, I just want to say thanks for joining our monthly early onset parent roundtable. You were diagnosed with FSHD around the age of 4, and your mother as well. And that prompted you to go into psychology and to sort of
not exactly. No.
exactly. Okay. And you're focusing your practice on people with chronic conditions and disability. Is that correct?
That's one aspect of my practice. It's not the focus of my practice, but yeah, it's one aspect of my practice.
So this is a pretty informal meeting. So thanks again for joining us. We had quite a few parents sort of asking questions about mainly how do they talk to their child about the diagnosis of FSHD or having a history of FSHD in the family. Yeah. Also, other questions like just how to cope with it, how to manage getting through life, with a disability. As far, like my son's a teenager, and being a teenager is hard enough, and then you add the can't smile and things like that. So that's sort of the questions I had, and just from the community. And Katie and Julie and some of the other, and Kristen, they're going to just pipe in with questions about what they have for you concerning their children.
Great. Yeah. And I mean, I hope it can be a discussion, and I would love to hear, really to respond to just what people are most wanting to talk about.
Kristen, do you have any sort of pressing questions that you'd like for David to answer concerning mental health or any of those things I talked about?
I mean, I don't have any pressing issues. I guess it's more for me, it's more as you start entering in the teen years, what are some of the things that we should be looking out for as parents, and signs of, the weight of having the disease on the mind. My child is only 11. She's pretty resilient. She doesn't show a lot of stress from having it from the standpoint of mental, but how much of it is that she's pushing down, or what are some of the signs that you should be looking for that kids need help or they need to talk to someone.
Yeah.
Good.
I only see 3 of you. Are other people here?
No, I think that's it for now. We record it, and we get a lot of people who come in
I see.
watch it later. So we are being recorded. So.
Oh, okay. I didn't realize that.
Julie, do you want to give you have a question for David?
You asked me if I have a question?
Yes.
No, I don't. My kitchen is a disaster, so I had my video off because I'm in the kitchen. But no, I don't have a question. I'm here just to listen in. My son is 16 in the teens, and it is he's pretty quiet, and I just and I think he's handling it okay. But he also we initially, when we found out he had FSHD, didn't even tell him, and he's known for about 2 years, but it's not well known. Only our family and a few friends know, and he hasn't shared it with a lot of his classmates. But I think it's getting to that point where they make comments all the time about his they call him Smiley because he never smiles, and they kind of make fun of him, but I think he handles it well. But but you know, I don't know kind of necessarily what, you know, what he feels about it on the inside, and I don't know. So I'm just here to listen. I don't have any urging, pressing questions to answer that in the long way.
Thank you, Julie. Katie, do you want to pipe in and ask something?
Sure. So I guess my question would be, my son was diagnosed around the same age, he was 5. So I guess, what did the progression look like? And kind of walk me through the struggles, like kind of the theme that we've been talking about. What would be helpful? What would be detrimental? As we kind of, like you said, as friends, we have to discuss it with friends, and we have to, you know, discuss the sports issue, and we have to discuss everything, because my son, his friends, some of them know it. We're kind of where we use the wheelchair. Sometimes we don't use it at school. So, you know, those are hard decisions, and we try to go to him, but how could us, one, what did the progression look like? Was it peaks and valleys? And two, what would you have suggestions for parents to support them?
So, all right, why don't I start by giving a bit of my background with this. And then one thing I want to emphasize is that there is no right or wrong way to approach this. This is incredibly, sorry, I'm getting feedback from someone. Okay. This is an incredibly personal, sensitive, and subjective subject. So I will share a bit about my experience and what I think is important, but I just want you all to know that this is, first of all, there's no judgment in terms of, you know, what people decide and how they decide it. And this is just, it's an incredibly nuanced topic. So my mother had FSH, and I was diagnosed around 4 years old, not with early onset, although I did have symptoms. I couldn't, I didn't close my eyes all the way. I had winging of the scapula, but I was able to play sports, but I couldn't keep my arms raised above my head. And I was born in 1975, so I'm almost 47. And there was no, I mean, of course, therapy existed then, but there was no therapy. That wasn't part of the equation. And my parents did tell me about it, but I didn't tell anyone. I didn't tell friends. I didn't tell teachers. I didn't want to talk about it with my own family. I didn't start talking about it with friends, close friends, until I was in college. Was that what, I mean, again, I don't think about that as right or wrong. It's what I did. I think I suffered as a result. And my parents didn't push me to tell people or tell, you know, so I had to do like the physical education exam in school, in elementary school. I couldn't do the push-ups and the sit-ups, but I didn't even think of telling the gym teacher, hey, I can't do that because I have muscular dystrophy. So as a result, I think there's a lot of shame that builds in the secrecy. So, and I do think that that's one real something detrimental about not normalizing talking about it, is the shame that sort of grows in the dark. And I still deal with, I'm open about it, and there's I don't want to say an advantage, but I do notice, because I also in working with people with different disabilities in my practice, that people who are diagnosed young and have very clear, you know, it's, you know, limitations, impairments, whatever you want to call it early on. One advantage is you can't hide it. Like you have to deal with it. And I think that there's something to be said for that. What honestly, in thinking in coming here and thinking about what I think is the most important thing that I would want to share is it's not how you talk about it. It's not what you say and don't say. It's not who you share it with. As parents, I think what's most important, and I'm a parent as well, by the way, I have 2 kids. What's most important is how we process it. And this is not just related to talking about the muscular dystrophy. It's about anything. Like if we have tons of, for example, anxiety and fear, and we're just compartmentalizing, we're not dealing with it, guess what? That's gonna get expressed indirectly to our kids. And so I think one thing I recommend as parents, because it's such a huge thing to be dealing with, is that the parents get support and go for therapy and have a place to talk about it. That I mean, that's by far, I think the most important thing that we can do. And be open to what our kids are bringing to us, not just in terms of what they tell us, like I'm feeling sad, I'm feeling ashamed, because often kids don't have the ability to do that, you know. So we have to look at their bit, like I acted out a lot, but my parents, they didn't know, they didn't understand, like to try to understand what is the behavior expressing. And because that's one thing, you're gonna have to do a little bit of reading between the lines, and normalizing talking about it. How are you doing? What's going on at school? You know, making it something that your kids feel that they can talk about with you, and that all the feelings are on the table, and never telling them, oh, well, you shouldn't feel ashamed or you shouldn't feel sad. That's like telling a kid not to cry, you know, when they're feeling sad. That's what they're feeling. So I think it's important to honor that and honor how difficult it is. I mean, kids can be, I think today in schools, kids are, I mean, there's a lot more emphasis on no bullying and inclusion. Not when, I mean, when I was a kid, it was, you know, that wasn't the case at all. So I think we're definitely moving in the right direction there. But it's also going to be like, you're going to talk differently to a 5-year-old than you will to a 13-year-old. But you also have to respect and follow their lead. There are going to be some kids who are just like, yeah, I talk about it. My friends know. This is, you know, it's something that's just out in the open. And other kids who are just like, no, I don't want to talk about it. And we can't force them. And we have to think about this. This is something that's evolving. We can't be complacent about it and just be like, oh, they don't want to talk about it. Great. Like, I think the fact that I didn't want to talk about it was in some ways a relief to my parents, because, oh, okay, now they didn't have to talk about it. And well, I don't think that that's really helpful. I'll shut up now. I'm going to see if anyone has any comments or questions or anything.
I'm curious, David, what do you think, looking back? I mean, who knows, it's, you know, but what do you think would have helped you as an adolescent? That if you were, could go in a time machine and advise your parents, what would you, or advise the teenage you, what do you think would have helped?
June, that's such a good question. And it's truthfully, that's something that I've grappled with and thought about so much, because for me, not talking about it was a survival mechanism. I desperately just wanted to fit in. And if I could, I mean, so it's hard to even know, wow, who would I be now? What would it have been like if I had been in therapy, if I were, had been talking about it with my friends, if it was just something that was like, yeah, this is just part of who I am. And I can't, it's so, because it was so extreme, because I was not talking about it with anyone, it's so hard to fathom. I think I would have felt a lot less lonely. I think I wouldn't have had the need to act out the way that I did. I started like drinking and smoking pot when I was 14 and had a big party in my house. And really, like, when, looking back, it's like I was desperate to be seen and understood. But of course I was not able to say that. I didn't know it, because I had everything so compartmentalized. So I think just being able, like, normalizing, being able to talk about it. You know what it's like? It's like, for anyone who has kids that are a little older, like my son is a freshman in college now, and and he came home for a weekend, and he was talking to me about a girl that he's interested in, and to be able to talk to him about it, just like, just normally, just to normalize the space, as opposed to just smiling, being like, ooh, you have a crush on someone or something. That's, by the way, that's my parents did that to me too. So what I felt like, I didn't want to talk about that with them. So if we can just normalize it and be like, yeah, this is a big, this is a big thing. You're going to learn so much from it. You're going to grow so much from it. You're going to have struggles. You're going to have joys. You're going to have, just like anyone else has. So normalizing it. Obviously, I'm a therapist. I think that therapy, if I could have been with the right person, because there are a lot of, just like in any profession, there are a lot of crappy or mediocre therapists out there. And so it's really important to find the right fit for you, and just someone to be able to talk, for a kid to be able to talk with someone about it who's not their parent, who has so much skin in the game, just to be able to talk about what their struggles are, what their challenges are. I think that would have been pretty incredible for me.
So I have a question for you. One of the big things with FSHD is not being able to smile. And a smile is such a nonverbal and, welcoming and things. And my son can't smile, and he's in a wheelchair and he can't hide it. And he was pretty well balanced, and he still is, but he handled it better when he was younger. Now he's in high school, and it's just harder for him to sort of make friends. And he sees like his peers going to dances and doing things like that, and he just doesn't want to engage. And I'm not, I just let him, but I feel like if he put himself out there, so to speak, more, he would probably be happier. But he's self-conscious about the whole thing, about being in a wheelchair, and it's hard for him to make new friends, because it's just hard because he can't smile, and people always think he's angry. Yeah. So how would you advise me to talk to him about that kind of stuff? Like, it is what it is, that when I say it is what it is, son, and you have a great personality, but you just got to let people see it. you know, they got to get to know you a little bit, but he won't like ask girls to dances or, you know, I feel like he's missing out on a lot of the experiences of a typical high schooler.
Yeah, and I think the reality he is, and he's not a typical, I mean, you know, he's not a typical high schooler in the sense that if he, you know, he looks around and there are all these, you know, people who can do all these physical things that that he can't do. That doesn't mean that he can't do other things, but it's totally understandable why, you know, he would be reluctant to put himself out there. Again, of course, I think it's great that you say, you know, that you say you've got a great personality, and of course you want him to have these experiences. To me, I would really focus on honoring what his and being curious and on trying to understand what his experience is. It's going to evolve. It's not going to be like this forever. Being a teenager is really, really hard, no matter what body we're in. It is so hard. I am so glad I don't have to do that again, and that I don't believe in reincarnation, because that would just, I mean, it's brutal. It's brutal for anyone. So it's going to get better, and I think it's something as a parent to remember too. Like this is going to, nothing stays the same. It's going to evolve. And if it were me, and going back to sort of related to what you said, Allie, and to June's question, if what I could have had just someone to listen, just someone to be curious about my experience, not tell me what I should do, not tell me that, oh, come on, you shouldn't care that you walk funny. You shouldn't care that you know, people are saying stuff about your smile. No, you should care. It's painful. It's hard. And just honoring that. You're like, yeah, you know, I think that's the best. I mean, that's the best thing that we can do, no matter what. Again, no matter what it is, whether it's related to the muscular dystrophy or something completely other than the muscular dystrophy. Honoring their experience. I think that is the most important thing we can do as parents.
I do have a
What-
question. I'm sorry. I have a lot of questions, but my son's 10 now and he's dealing with transitioning or not using wheelchair, and he has lots of back pain. He has, you know, a lot of pain, but he's a trooper. So at school, he tries to troop along. And so I guess if he were here to ask questions as you progress, since, I mean, I know everybody's progression is different. How did you deal with pain in school while you're trying to be with your peers? And I guess what age did it hurt the most? I guess is kind of the questions he asked me. I'm a nurse, but I still can't ask, you know, I can't answer all those questions because I don't have this experience. So dealing with pain with your peers, and as a parent, me, you know, explaining, okay, is it going to get worse? Is the pain going to get worse? How are we going to deal with that? I don't know. You might not have all the answers, but that's a big topic that's come up.
Yeah. Well, first of all, I mean, I didn't have pain personally as a kid. The kind of things that people would point out, like that people would say, why don't you blink? Or you walk like a duck, or you know, things like that, and I would be avoiding doing things that would be just automatically avoiding things that would expose me. Dealing with, of course, there's no way to know for him when you're pushing yourself so like so much to walk, when and if it's causing him more pain. It's number one, it's understandable why he wants to keep pushing himself to walk, and I would honor that, you know, And he's going to, you just have to be there to support him through this process of sort of his timing of when he's like, all right, I need to use the chair more, because this is just too much. And another thing that I've got to say, that this was definitely not the case when I was 10, is that I'm in a clinical trial now. There's another clinical trial, 2 other clinical trials starting now. We are in a whole different universe in terms of possibilities, and for a 10-year-old, like the hope and the possibilities here. Of course, that's not the only factor, but God, it's a big one. It's a big one for us, as parents. It's a big one, but also for our kids, really believing like that there are going to be things, or there are already things happening that are going to help to change the course. So how do we best take care of ourselves now? And staying active without overdoing it, or and attending to the psychological, to the emotional pieces. And I do think therapy is tremendously helpful. And yeah, I'm sorry, I don't have a ton to say in terms of the pain. I don't know.
No, that was helpful. I appreciate that. That is a big part for us.
I was going to say, I don't know if you saw our webinar earlier this year on pain management. It's on our YouTube channel, and you might want to watch it. I think the most important part of that presentation, it was given by a neurologist, a physical therapist, and a psychologist working together. And they said, pain is not just, you take a pill and it's gone, or you do one thing, and it's not just a physical, it's an interplay of the physical and the mental. And to effectively manage pain, you need a strategy that uses all of these things, and so I would highly recommend that presentation. I learned a lot watching it, and it might give you some ideas of strategies, and I hope is your son getting physical therapy right now?
He is very recent, not very often.
Yeah.
The physical therapist didn't see improvement, but he does play some sports, so they saw that he's doing golf. He did recently have to give up soccer because it was too much, but he's staying active. But I appreciate it. I will absolutely look that up.
Yeah.
I appreciate that.
Yeah. And I also just wanted to mention, as someone who I had a daughter who was going through kind of, I guess I would say, more typical like adolescent things, like crazy party and those sort of things, but acting out in certain ways. And I wasn't really, we weren't sure what was going on, but we did find a fantastic therapist who specialized in adolescence. And, and she just set very clear about, that this was for, she would talk to my child. She would not share what they discussed, with the exception if there was an immediate danger, to my child. But that the adolescent, that my daughter, would have a safe space, a confidant, that she didn't have to worry that was going to come back to us, or that we, and then there were appropriate times where the therapist would talk to us about generally what's going on, but she'd also explain why it was important, because obviously some parents might want to just like, tell me everything that's going on. I want to know, what my child is telling you, it's so important, especially in teenage years. They're trying to define themselves. They're trying to gain their independence, and you have to honor that. And I think sometimes you think, well, you know, family, like you should be able to talk about it amongst yourselves, but it's hard. There might be things that your child doesn't want to say because they don't want to hurt you. They don't want you to worry, you know, so they'll kind of paper it over, but then, you know, they have someone they can just spill it all out to and not, you know, and vice versa for the parent to feel like I really don't want to, you know, I'm not sure how to say this, or don't want to put a burden on, you know, whatever it is. So I think the therapist can play a really important role in kind of, you know, giving you that safe space to talk without having the burden of like, how is this going to affect my parents, or how are they going to feel if I say this, or, you know, et cetera. So I think it's really powerful. And as David said, you have to find the right person.
Great. No, I think that's great. That's a great idea. I appreciate that.
Another thing that's available now that wasn't when I was a kid is there's so many online communities where you can connect with people. Like in the past year, I've become really interested in cryptocurrency, and I've become part of this community. And the person who's in charge of this community happens to have SMA, spinal muscular atrophy. He's been in a wheelchair all of his life. He only has partial use of one finger, and he's just a brilliant, incredible guy. And you get the chance in these communities to just meet with all sorts of people where, you know, really disability is pretty much irrelevant. So that's definitely a way to support connection, other types of connection for kids. And there was something, trying to remember now, there was something you said, June, that I wanted to respond to, but I forgot.
It'll come back. But I did want to mention, we have this group of young people, or Gen Zs of FSHD. And I think, you know, they might be, you know, your child is a little younger, but I think they might be wonderful mentors for, you know, and they are young people who have gone through their own struggles and are able to talk about it. They had a lot of therapy, some of them, and a lot of support. But I think it can make a huge difference. I mean, as David said, he was so alone as a, you know, kid. Have someone who also has FSHD and can relate to that directly, I think could be really valuable.
Would that
I do
age,
have to,
what age
sorry?
could they what age could they participate in that Gen Z?
Well, we sort of usually say 13 is sort of I guess that's considered the,
Gotcha.
but I think we could definitely like put people together, younger kids together, if they're interested in, you know, I mean, in the past, we've had kids who become pen pals, or, you know, now you have Zoom and other things.
Yeah.
But
Katie, my daughter is 11, and she would have no problem, you know, chatting and having a Zoom call with. Now that she's staring at me right now. She's like, "What are you volunteering me for now?" Nothing.
Mine's a
Nothing.
talker, so he would, I don't know where he gets it from, but yes, I think he would love that.
So the other thing is she has someone she's 28, but she has someone who she's known for 6 years that has FSHD. And I think that that's been super helpful because there is no one in our family that has it. And I think that that's helped her a great deal. One question that came up, June, off of what you were saying with they don't want to worry you as parents. One thing that I know that I do all the time, I'm like, how are you feeling? Do you feel like are you feeling like that muscle's not working like it used to? Like I'm all over her. And is that too much? And is that causing more harm than good? And, you know, it's hard for me to pull back because that's not who I am. But, I feel like sometimes maybe I'm being too aggressive with asking questions about, how are you feeling about that? And is that, creating a barrier for us or not? Is that opening the door for her to talk to me, or am I just not approaching it right?
Kristen, the fact that you're self-aware enough to be able to recognize that that's a dynamic and that you're asking that question puts you, that's the best gift that you could give your kid. It's, it's not about, like, I don't know. I don't know what I would ask her. Is it too, like, please, I would say to her, hey, can you, please tell me if it's like, if it's too much, if I'm, asking you too much. But again, the fact that you are willing to think about that and reflect on that, I guarantee, like, I can tell you that's amazing. That's a huge gift. So you're gonna, like, as parents, we, no matter how hard we try, we're always making mistakes, right? And the best thing that we can do is be humble enough and curious enough to try to, like, learn from those mistakes and to grow with our kids and teach our kids and allow our kids to teach us. And so I just I applaud you for that. The
Well,
question,
one thing, like,
sorry, the question is much more important than the answer. In other words,
I was going to say sometimes, because Kristen, I think you're worried, like, am I coming on too strong? I'm like too, this is, I don't know if it's a perfect analogy, but of course, as kids get, into their adolescent years, sex is the big, like, are they gonna, get in trouble there, whatever. And I remember to my daughters, I said pretty early on, it was good. I said, I want you to know you can always come to me and I'm not going to freak out. Like, I want you to understand that, if you find yourself, at a party and you're in a situation or a bad situation, like, I just care about your safety. I want you to always feel you can come to me. I'm not going to interrogate you. I got learned to not interrogate. It's hard to resist it. It's like, why were you out that late? And what were you doing? Blah, blah, blah. But I thought it was much more important. Like, I don't want them to feel like they can't come to me because I'm going to flip out or I'm going to get mad or, that. So I think with something like this too, maybe like, just, you can always come to me if you're worried about something, you're noticing something, and we'll solve it together. Like, I'm not, because I think a child might be concerned, like, you're going to worry, you're going to get upset, you're going to get that something's going on, so really important, I think, as a parent to decatastrophize.
And June, can I piggyback on that? Because it's to decatastrophize, and also it speaks to the importance of, as parents, us working through our own anxieties and fears, and because again, when we don't, it gets communicated indirectly or directly. So that's just so important.
And one other question that I have is the balance of the disability and the accountability. And sometimes it's, you let them off the hook of not having to do the chores as much, even though they should be just as responsible if they don't have a disability. And so where's that balance? And then also right now we're in the process of going through school selections as she's going into 7th grade. What is the best school for her? And is it the small coddling environment to just know you got to live life and you can't be coddled your whole life? So, finding that right balance of, the right environment that's going to keep her confidence high, which she has right now. But also that balance of she's got to operate in the real world with a disability. That's just reality.
Yeah, that's a great question. I would prefer to call the smaller school, calling it more supportive environment versus coddling. And I think if there's a school that, again, I would follow her lead too. But if there is a more supportive environment, that's great. I mean, she's still going to be with all sorts of kids and all sorts of people. Like we don't have to just throw them into the deep end in terms of like to a giant public school just because, all right, you've got to toughen up, or that there are having FSHD, it's such an immense challenge, but it is also, it gives us kind of in some ways superpowers in terms of the things that we have to constantly the challenges that we have to navigate. And I just remembered what I wanted to respond to before. The challenges that we have to navigate, and constantly, and using our being creative, using our minds. So I would say, if you really like the school, that's the smaller school that that is more coddling or supportive, and if that feels like a better fit, I mean, personally, again, this is very personal. Like, if you say no, I think she should go to the big school, fine. That's your, that's okay too. But I think it's okay. They've got enough challenges. We don't need to, make sure that they have more if it's a good fit. And in terms of the chores, to your question about the chores, I think if it's something that they can do and it's not painful, or obviously, you're not going to have them do things that are impossible for them to do or causing them pain, but definitely it is important to be accountable. They are human beings who live in a world, and there's going to be increasing accountability. And and also, as someone with FSHD, you want compassion and empathy, but you don't want people to feel sorry for you. So I'm all for accountability and chores.
What about siblings? What if your siblings have to do more? I guess that was kind of one of the questions. My son's a twin, he's fraternal, and his twin does not have it. So the impact and, navigating with siblings.
Yeah, that's that's a whole other thing. The sibling is going to need support too. And I can generalize in terms of some of the things that they might be experiencing in terms of guilt, in terms of resentment, competition for or feeling like there's not enough space for them, so they have to either overcompensate or retreat. So just being mindful of, there are strategies that kids employ, often without being aware of why they're employing them. And our job as parents is to read between the lines, try and see, make space for them, be curious about what's happening, normalize their experience, the one that doesn't have FSHD, and have, that they have a space to, yeah, you're right. I hear you that, you shouldn't have to do 5 times more. What do you think? What do you suggest? What do you think? Asking them to be a part of it. Clearly your sibling can't do certain things, or it's really hard for them to do certain things. So let's get creative here to find things that to make it more equitable, and so that we can work as a team, because we're a team.
One of the things I think has helped my son once he got older was sort of to advocate for himself. Like he's written a few articles and he's done some things and gotten involved with the FSHD Society. He feels like he has a little bit more control, and I think that's helped him a lot kind of deal with it. And also the other thing I always try to tell him is, he gets sort of a lot of attention with walks and stuff. People come out and walk with him and stuff. And I'm like, but you have to give back as well. There are other people out there that you can be charitable to as well. You shouldn't just always accept that sort of charity, quote unquote. And I think that has helped him kind of stay balanced. But I think getting involved and being an advocate for himself, I think has helped him deal with it a little bit.
Yeah, it's such an important point. It's like whether you have FSHD or not, when you advocate, when you give back, when you and as opposed to just taking, you're gonna be happier. I mean,
I agree with that, Ali. I agree. The advocacy that has been huge for Kate. And again, it's also put her in touch with other people that she's made bonds with that are doing it with her, not only people affected, but also her friends have stood up and created a whole team to do the walk and roll with her and raise money. And it's been a great experience for her to have that. And she got on the news, so.
That's awesome.
I have to say, I have not met a single young person, I mean, and maybe there are, but who, when they did share their diagnosis with their friends, every single one of them received so much support from their peers. I mean, they were shocked. They were afraid they'd be, ostracized or looked down, and it was the opposite.
Yeah, I mean, I think we live in, thankfully, in, I think, a world that is just much more receptive to difference and embracing diversity of all kinds. And I think that's just wonderful.
So David, we only have about 10 more minutes left in our meeting. Do you have any kind of golden nuggets or parting words of wisdom that you kind of want parents to take away?
Yeah, I'll repeat. I feel like I'll repeat something or reframe it, that I just think the fact that you guys are here, the fact that you're, willing to sort of be curious and ask these questions and explore and talk about these things and think about these things is by far the most important thing. It's not about finding the right thing to say or do. That's not it. That's like focusing on the wrong thing. Your love and willingness to engage in this way is like just the biggest gift that you could be giving your kids. That's number one. And number two, that don't forget that you guys need support too. And there's no love greater than the one that we have for our kids. And that doesn't mean that we can, if we want to be as effective and helpful and advocate as much as we can, we have to do whatever we can to take care of ourselves. And you have to be fierce about that, fierce about taking care of yourselves, because you deserve it and because you need it. And that doesn't mean that you're doing it at the expense of caring for your kids, because you're always going to take care of your kids. So yeah, I would say those are the two things that I feel by far are the most important.
Anybody
info.
else? Yeah, thanks. Does anybody else have any other questions or comments or anything for the group? No? David, thank you so much for being here. I think this is an important topic, and I think a lot of parents, it weighs on us, all of us. So thank you for giving us some good advice and a way ahead for some of these things. And also, like you said, I think just connecting with other parents. I know talking with Kristen and other parents has really helped me just commiserate together and learn from each other and help each other out and support each other as best we can. So thank you all for being here. And June, thank you as always for coming.
Thank you.
Thank you for having me. Yeah.
Thank you, David.
Yeah, it's been an honor to be here with you guys.
So,
Thank
great.
you.
Well, thank you.
You guys have
Bye.
a good night.
Thank
Bye.
you.
Till next time.